Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Today, we will have 5 speakers addressing you this afternoon. Premier Blaine Higgs, Hugh Fleming, the Minister of Health, Dr. Gordon Dow, Infectious Disease Specialist, Horizon Health Network, Dr. Nicole LeBlanc, Regional Chief of Staff, Vitalité Health Network, Dr. Jennifer Russell, Chief Medical Officer of Health. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Aujourd'hui, 5 intervenants s'adresseront à vous. Les porte-paroles aujourd'hui sont le Premier ministre, l'Honorable Blaine Higgs, le ministre de la Santé, l'Honorable Hugh Fleming, Dr. Gordon Dow, infectologue en chef réseau de santé Horizon, Dr. Nicole Leblanc, médecin-chef régional du réseau de santé Vitalité, et la médecine hygiéniste en chef, la Dr. Jennifer Russell. Maintenant, je vais demander le Premier ministre à vous adresser. I will now ask the Premier to come to the podium.
Good afternoon. Bonjour. As we've said many times, New Brunswick is dealing with an extraordinary challenge as a result of COVID-19. This situation demands that our province be able to react quickly and effectively to ensure that we minimize the impacts of the virus. Our mission is simple. We need to do everything possible to save lives, keep people safe, and lessen the impact on New Brunswickers, as well as our province's economy. Nous devons protéger le Nouveau-Brunswick que nous aimons. Et nous devons répondre aux besoins de la population au niveau de la santé physique, sociale et mentale. Les gouvernements sont souvent critiqués pour ne pas réagir assez rapidement. Dans une période comme nous vivons présentement, il est absolument nécessaire d'agir rapidement. Nous devons être capables de réagir en temps réel à mesure que la situation continue d'évoluer. Le virus ne va pas entendre. We cannot afford to put the health and safety of New Brunswickers at risk because of bureaucracy. We need to make sure testing is being done as efficiently as possible. We need to make sure our frontline healthcare workers can access the personal protective equipment they need without having to wait for multiple approvals. And if I was to give an example of that, not long ago, we signed off on, through the Department of Health and through the different health structure and authorities around the province, we signed off on a personal protective equipment protocol. It took 2 weeks to sign off and 23 signatures. And I guess it's an example of if we are going to fight a virus effectively and decisively, we can't be in a system where it takes 23 people to sign off each time that we make a decision. And that's why it's exciting to move forward in a direction we are now for a rapid response. We must make sure we're following standardized practices across the board. We're putting resources where we need them. We are recognizing government as the situation changes to deploy staff to different areas where they are most needed. Déjà, nous avons réagi rapidement. Plusieurs patients qui reçoivent d'autres niveaux de soins dans des hôpitaux ont été déplacés dans des foyers de soins et dans des foyers de soins de longue durée pour augmenter notre capacité dans les hôpitaux et pour protéger les aînés. Nous devrons continuer de travailler avec les syndicats du secteur public pour nous assurer d'avoir une approche collaborative afin de lutter contre ces virus. But I believe there's still room for us to improve our methods and react with greater speed. As a government, our role right now is to empower, expedite, and facilitate the essential workers who are putting themselves at risk to protect us all. We are all united in this mission. That is why we're adding an element to our emergency declaration to provide the Department of Health with the authority it needs to respond to COVID-19. We're taking steps today to implement a pandemic task force. The task force will make sure that our health and long-term care systems are as responsive as we need them to be. This approach will implement actions and deploy resources across all aspects of the healthcare system. It will be coordinated with and supported by New Brunswick's Emergency Measures Organization. The Pandemic Task Force is composed of Dr. Gordon Dow of Horizon Health Network, Dr. Nicole Leblanc of Vitality Health Network, the Chief Medical Officer of Health, Dr. Russell, and Deputy Minister of Health, Gerard Rashad. They will all work hand in hand with Health Minister Ted Fleming. This task force will be vested with decision-making authority about the pandemic response for all aspects of the healthcare system, including extramural, Ambulance New Brunswick, the regional health authorities, and all nursing homes and special care homes. A clinical group of experts with relevant experience will be called upon as needed to provide clinical advice. Le groupe de travail sur la pandémie va prendre des décisions et ces décisions seront mises en application par le Centre d'opération d'urgence du ministère de la Santé. Le cabinet et le comité multipartite du cabinet sur la COVID-19 soutiennent cette nouvelle politique. Going forward, this is how the medical system will work to combat COVID-19. This approach will allow us to react in real time. I wish to thank all members of the pandemic management team, especially Dr. Dow, Dr. Russell, and Dr. LeBlanc, for taking on these significant responsibilities at this very important time in New Brunswick's history. Merci beaucoup pour votre dédication et contribution à notre province. Merci.
Good afternoon, ladies and gentlemen. We all know that the situation regarding COVID-19 is evolving quickly, and the policy and response of the government has been to move quickly as well. The amount of time that I have spent over the last number of weeks and days, it became clear that the speed at which things needed to unfold, I was concerned that it was not at a speed that would keep up to the relentless surge of this virus. The worst thing that we can have in the front line of healthcare are our workers saying things and hearing things like we need to get approval, we're waiting for approval, I will send it up the line, I haven't heard back yet. We can't do this in these times. While waiting for these type of approvals, our frontline health professionals are becoming concerned and worried as this situation advances. And I want to thank all those people, frontline healthcare workers, for their hard work and patience. Today's announcement is that we are establishing a pandemic task force, and it is intended to make the best moves quickly, efficiently, and to work in support of rapid assistance to our front lines. We all know that large organizations, it's not unique to government, but by their nature, they are not quickly moving organizations. That's no criticism, that's just the way it is. But we cannot allow this virus to spread quicker than government and the health authorities are able to make decisions and keep up with it. The virus moves at its own relentless pace, and we have to be ahead of that. The leadership in government and the regional health authorities is top-heavy for a pandemic emergency, and although this may be normal in normal times, I think we can all agree that these are not normal times. What we are essentially doing today is implementing a military-like command and control protocol with respect to this virus. Typically, a command center makes decisions, they make them quickly, and they deliver those decisions fast. The control operation takes those decisions and executes fast. The whole question and the whole key here is speed. We must stay not on top of this virus, but ahead of it. Jurisdictions around the world are paying the price for not acting fast enough. We were at one time criticized, but I don't think anyone's criticizing us now. And our government made the decision, with the support of all the other parties, that putting the safety and well-being of our citizenry first. If that was something we would be criticized on, so be it. Today's decision is consistent with that approach. This approach is one that is a battle, and in a battle, we must fight to win. It came upon us very quickly. Remember, it's not that long ago we were all celebrating Christmas with our families and loved ones, and at that time nobody had ever heard of COVID-19. It wasn't even named. Nobody heard coronavirus. It came upon not New Brunswick, but it came upon the world rapidly and relentlessly. The role of government in this battle is to facilitate, expedite, open bottlenecks, take down roadblocks, break up log jams, and give the medical experts the support, the encouragement, the funds that they need, not just to fight this, but to fight and win. We need to let medical experts decide quickly, act quickly, and implement quickly. This is not unlike what we have witnessed over the past number of years with hurricanes. We don't know if this is going to be a level 3, a level 4, a level 5 hurricanes, but prudent people, they put plywood on their windows and they secure outside objects and they make appropriate provisions so that when the storm comes, we're ready. Hopefully, it will be better than we're planning for, but we need to plan for the worst and hope and pray for the best. I want to thank the members of the task force for coming together and working to protect our healthcare workers and New Brunswickers. When their province called upon them, they immediately and without reservation or hesitation came forward, working together to do what needs to be done to win. I want to thank my colleagues in government for the support of this initiative, as well as Mr. Vickers, Mr. Kuhn, and Mr. Austin, whose unwavering support for this has been appreciated and beneficial. That's the level of teamwork that we need, that will be necessary to fight and defeat this virus. With COVID-19, it is incumbent upon all New Brunswickers that every single one of us play our part. Social distancing is serious and it is necessary. And it works. It flattens the curve, so to speak. And I'm confident in this new task force. I'm confident in the people. And I'm confident in our healthcare workers. And I'm confident in New Brunswickers. Thank you.
Good afternoon. C'est mon plaisir de vous présenter aujourd'hui. The qualities of the pandemic task force just described by Minister Fleming are designed to provide our support for our 3 defenses against COVID-19. We have 3 defenses against COVID-19, and I want to describe them to you like a hockey analogy. Think of yourself as the goalie. All New Brunswickers are the goalie, and the puck is the COVID-19 virus. So our first defense are our defensemen, and that is Dr. Jennifer Russell, who has done a marvelous job really preemptively doing things to protect the public. And these public health measures include closing our borders, identifying new cases and contacts, isolating people that require isolation, eliminating mass gatherings, and the declaration of a state of emergency, closing schools, closing businesses. Painful but absolutely necessary. Those are all designed to block pucks from coming your way. Your second line of defense is you, the goalie. And you also have defenses. The first are your mitts, and the first thing to remember is you have to wash your hands and wash your hands and wash your hands and don't touch your face. Your second is your mask. And the mask is there to remind you not to touch your face, number one. And number two, you'll be hearing later today about the fact that we will now be recommending masks for people who cannot maintain social distancing within and without hospitals to protect other people. The third thing is your stick. You use your stick to clean your crease, and this is about environmental cleaning. This virus is contracted mostly by contact, things you touch, and then you touch your eyes, your nose, your mouth, and you're infected. So cleaning all surfaces, doorknobs, anything you come in contact with, when you get groceries, washing your hands when you go in and out of the grocery store are extremely important. The final thing is stay in your crease. Do not go within 6 feet of anybody. If you're sick, don't leave the house, and only leave the house if you have to. So that's our second line of defense. Our third line of defense is our net. Now, our net is our safety net. So for those of us who do get COVID-19, we have been working tirelessly across the province to make sure that your healthcare system is ready and waiting for you, from screening people at the door, stopping visitors, developing COVID teams, developing COVID wards, updating our ICUs. There has been a lot of work going on, and everything that this pandemic task force does is designed to make those three lines of defense work for you. So remember, we're all working as a team, and stay in your crease. Thank you.
Bonjour. On est en pandémie, on est à la guerre. On est dans une situation extrême qui demande des mesures extrêmes. On va être honnête, il y a beaucoup d'inconnus quand on parle de pandémie. Puis on comprend qu'il est difficile de naviguer dans l'inconnu. Mais au Nouveau-Brunswick, on est privilégié. On est privilégié d'abord parce que, sous le leadership de Dr. Russell et la santé publique, on a mis en place et on a été proactif dans les actions qu'on a prises de façon très, très tôt. On a mis des mesures de distanciation physique, la bonne hygiène, le lavage des mains, on a fermé les écoles, on a fermé les lieux publics, on a arrêté les rassemblements, on a limité les frontières, on a isolé les gens qui devaient être isolés. Ceux qui sont affectés, on a contacté les contacts. Puis ça nous a permis de pouvoir bien planifier. Ça nous a permis de gagner du temps. Puis ce temps-là, dans d'autres pays, malheureusement, ils ne l'ont pas eu comme que nous, on a eu le privilège de l'avoir. Puis si on peut maintenant venir avec un plan unifié, je pense que c'est grâce à chaque citoyen et citoyenne qui a écouté les consignes, qui ont fait l'isolement, l'auto-isolement, puis qui ont fait en sorte qu'ensemble, qu'on prenne les meilleures mesures d'hygiène possibles. Puis, ce que ça nous a aussi permis de faire dans la planification, c'est que ça nous a permis de puiser de l'expérience des autres pays, mais aussi de l'expérience des autres provinces. Puis pour donner un exemple pratico-pratique de ça, on entend souvent les gens donner beaucoup de conseils, beaucoup d'opinions. On est tous dans une situation qui est un peu difficile actuellement, puis tout le monde veut faire du mieux qu'ils peuvent pour tenter d'informer ou de tenter de faire en sorte qu'on écoute les recommandations. Mais sachez qu'on a mis en place des comités d'experts qui, avec des médecins, des chercheurs, des épidémiologistes, les gens qui nous permettent de voir les prédictions, des spécialistes, des experts dans tous les différents domaines. Ça nous a permis de mettre en place des équipes qui font l'analyse de ces données-là, l'analyse des données probantes, puis de pouvoir puiser de l'expérience puis l'expertise des autres pays. Moi, je pense que ce comité ici aussi va nous donner, c'est ça va nous permettre de justement pouvoir puiser de ces grands experts-là, puis on en a plusieurs dans la province du Nouveau-Brunswick. Moi, j'ai jamais été aussi fière du leadership puis de nos collègues de travail et des experts qui sont venus ensemble pour combattre cette pandémie. On se doit d'être rapide, efficace et unis. Fait qu'aujourd'hui, moi, je viens devant vous, pas juste avec mon expertise, mais avec l'expertise de toute mon équipe, de toute notre équipe et le support de mon PDG. On se doit d'être rapide, efficace et unis. Je le répète. On doit maximiser le partage de ces expertises-là et de maximiser l'alignement pour combattre cette guerre. Mais on a aussi besoin du public. On a besoin de chacun d'entre vous de suivre à la lettre les consignes du médecin hygiéniste en chef si on veut effectivement aplatir cette courbe. Restez à la maison et lavez vos mains. On est en pandémie, on est en situation extrême qui demande des mesures extrêmes. On est à la guerre. On va avoir besoin d'être unis plus que jamais, puis je suis convaincue qu'ensemble, on va sauver des vies.
Merci, Dr. Leblanc. Thank you, Dr. Dow. It is really, really wonderful to be here today to speak with my colleagues in both regional authorities, clinical experts in their fields, and I do feel very supported and very strengthened in terms of the connection of public health through the Special Advisory Committee, through Public Health Agency of Canada and the Office of Chief Medical Officer of Health of this province. So it's a very good day to be able to share this good news with you all, with my colleagues, and the Minister and the Premier. Good afternoon, everyone. Today we have 2 new confirmed cases of COVID-19 in New Brunswick today, and this brings our total to 103. We appear to be in many ways faring better than other jurisdictions, and our case numbers have been relatively low, and our hospital admissions have been relatively few. The incidence of community transmission appears to be relatively rare, which is exactly why we cannot relax. Aujourd'hui, j'annonce qu'il y a 2 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick, portant le total à 103 cas dans la province. À bien des égards, il semble que nous nous en tirons mieux que bon nombre d'administrations ailleurs dans le monde. Le nombre de cas signalés dans la province est relativement faible. Le nombre de personnes infectées qui ont dû être hospitalisées est relativement faible. Le cas de transmission communautaire semble aussi être relativement rare. C'est pourquoi nous ne pouvons pas baisser notre garde. We cannot lose our vigilance, even for a moment. Family gatherings have to stop. Churches must be closed. Mass gatherings of any kind must not happen. Stay home, because staying home will save lives. The fight against COVID-19 is far from over, and in many ways it is just starting. How we fare in the weeks ahead depends entirely on the actions we take today to slow the spread of the virus. The new cases reported today are both in Zone 1, the Moncton region. 1 individual is aged 20 to 49, and 1 individual is aged 40 to 49. Both of these cases are close contacts of previously confirmed cases. The advice that my office has given and the emergency declaration by the province, which gives this advice to the force of law, must be followed to the letter. Les 2 cas que j'annonce aujourd'hui sont tous les 2 dans la zone 1, qui est la région de Moncton. Une personne infectée est âgée entre 20 et 29 ans, alors l'autre est âgée entre 40 et 49 ans. Les 2 personnes ont eu des contacts étroits avec des cas confirmés auparavant. Il faut respecter à la lettre les directives fournies par mon bureau, ainsi que la déclaration de l'état d'urgence faite par le gouvernement provincial, déclaration qui donne force de loi à ces directives. There have been too many instances of people flouting these rules, seeking loopholes, or attending gatherings they presume are free of risk. No gathering can be free of risk right now. Don't go to a friend's home and stand in the driveway sharing a coffee. Don't invite your siblings and their families over for dinner. Don't go to church or attend any form of mass gatherings. When you do this, you are putting yourself and your loved ones and every New Brunswicker, including our healthcare workers, at risk, in unnecessary jeopardy. N'allez pas à l'église et ne prenez pas part à aucun rassemblement de masse. En prenant part de tels événements, vous vous mettez inutilement en danger et vous mettez inutilement en danger vos proches et tous les citoyens dans la province. Act as if you have the virus and do everything you can to avoid further spread. That means washing your hands regularly and thoroughly. That means keeping your interactions with others as brief as possible. That means maintaining that vital 6 feet of physical distancing when you encounter people outside your home. Si la santé publique communique avec vous dans le cadre de son enquête sur un contact potentiel avec une personne infectée, vous devez suivre les instructions spécifiquement précises qui vous êtes données et les suivre à la lettre. If you are contacted by public health in their investigation of a potential contact with an infected person, you must follow the specific instructions that you're given and follow those instructions to the letter. Above all, it means staying home, in your own home, and encouraging others to do the same. The sacrifices we all make now will determine the severity of this outbreak. And we can do this, but only if we take these necessary steps to slow the progress of COVID-19 in New Brunswick. Les sacrifices que nous faisons tout maintenant détermineront le degré de gravité de cette pandémie. Nous pouvons y arriver, mais nous devons prendre les mesures nécessaires pour ralentir la progression de la COVID-19 au Nouveau-Brunswick. Thank you very much.
Thank you, Doctor, Minister and Premier. Nous allons procéder aux questions des journalistes. Chaque journaliste aura une question. Vous avez le droit de poser vos questions dans la langue de votre choix. Each reporter will have one question, and you have the right to ask your question in the language of your choice. Premièrement, M. Yvon Duguay, CKRO. Yvon? Yvon Duguay. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for Dr. Russell or Dr. Dower or Dr. LeBlanc. A recent study published in the Journal of American Medical Association found that under the right conditions, liquid droplets from sneezes, coughs, and just exhaling can travel more than 26 feet and linger in the air. And reports are also now showing that virus particles can be found in the ventilation systems in hospital rooms of patients with COVID-19 in China. I spoke with a doctor at MIT this morning who said that in the absence of not knowing exactly how far virus particles can travel, it's best to be conservative and play it safe. So with allergy season upon us, should we increase the 6-foot physical distance that we are having between people?
This idea of aerosols traveling further than 6 feet is not a new one, as we've known that when someone coughs or sneezes, that although the majority of these biological aerosols or droplets drop to the ground within 10 minutes and do not travel beyond 6 feet, there are a small number that remain suspended for a short period. And some of those do end up in ventilation systems, in airplanes and in hotels. It's been well documented. The gap in our knowledge is it's not known if those are infectious. That small amount is of unknown consequence. And in keeping with that, the new regulations that will be coming out about not only social distancing, but wearing masks in public is going to go a long way to address that issue. It is an area that's unknown, but in the interest of safety, wearing a mask when you are out in public is an area that was previously of uncertainty. But as you know, with this pandemic, things are changing all the time, and our advice is changing with the new evidence. And so we are recommending that people start to wear a mask in public.
Thank you. Vicky, do you have a quick follow-up?
I do, thank you. As the virus spreads around the world, younger people are being hospitalized at unexpected rates. What factors do you attribute to the number of younger people, particularly in North America, who are experiencing severe cases of COVID-19?
There are some young people experiencing severe cases of COVID-19, but they are not the rule. And overwhelmingly, the data shows that your risk for complication goes up with age and with medical conditions. So yes, while we are seeing it in some young people, overall, it is a condition that is seen in the elderly. Having said that, it should be a reminder for everyone that they need to take this virus seriously, and just because they're young doesn't mean that they should be taking any chances. So thank you for that great question.
Thank you, Doctor. Thank you, Vicky. Charles Camirant, TVA Edmundston.
Oui, ma question s'adresse au Premier ministre Blaine Higgs. Vous avez annoncé au courant des derniers jours comme quoi la GRC et les polices au Nouveau-Brunswick pouvaient donner des contraventions à tous ceux et celles qui ne respectaient pas les mesures de distanciation sociale. Ma question est la suivante. Est-ce que vous croyez que la GRC est en mesure là, de donner des contraventions à l'ensemble du territoire, c'est-à-dire de couvrir tout le territoire du Nouveau-Brunswick?
Well, I think that's why we have more than the RCMP engaged in this. We have our own safety compliance officers that are also authorized to give tickets as well. I think to date we've actually given out about 9 for violations. You know, usually the process is there's a warning requirement, and we go through that. But then in the case of the border, we've seen repeated offenses of more or less people just out for a drive rather than out for a purpose. And we need to control that. We need to stop that. We can't take our current situation for granted, as the doctors have repeatedly said. So in order for us to be ahead of this curve and stay ahead of this curve, we need to stay focused on all mitigating methods to avoid the spread.
Thank you. Monsieur Camirant, as-tu suivi?
Non, merci.
Merci, Charles. Jacques Poitras, CBC.
Hello, to the Premier or Minister Fleming. Why was this task force not put in place earlier? What has changed that makes it necessary now?
Jacques, I'll start, and the minister may want to add to that. I think as the time goes on, you know, we look at where are the best practices, what have we learned from others, how do we implement a faster protocol, and I think in discussions the minister and I have had about where we can actually avoid, let's say, a lot of unnecessary discussion, a lot of unnecessary procedures, but actually deal directly with the issues, allow the professionals that have stepped up here to be to consult with whomever they wish, to help us make the right decisions, and then to implement across the province in one unified fashion. You know, we'll continue to evolve. You've heard that mentioned many times. This whole ability for us to deal with this in a fast, a rapid response is based on our ability to evolve and create the right structure for making that happen. And I believe that is certainly what this is. It's like, I think Minister Fleming's referred to it as a command post, and that's what you need in a time of crisis. Minister?
Yeah, as the Premier said, I mean, I answered the question by saying, if not now, when? When I said in my early remarks, Christmas dinner, we didn't know there was such a thing. And the first line of defense is social distancing, it's closing schools, and then as we ramp up to the next step, which is preparing for the virus, the third stage is fighting the virus, and the fourth is the aftermath where we get things back to normal. So job one was preparation, and we've seen what Dr. Russell and public health has done. We've seen what the government has done with closing schools, getting out in front of this. And so that was really the primary focus. Job one was preventative. And let there be no mistake about it. This is going to be defeated outside of the hospital, not inside. It's going to be defeated by people changing their behavior. It's going to be defeated by prevention, because there is no cure. Don't forget that. There is no cure for this. So it is incumbent upon prevention. And when it comes to young people, sure, young people, the vast majority of them are going to, perhaps if they do get it, they're going to recover, but they may kill their grandparents. And that's the thing that young people need to realize, that it's not just about you. It is about your community, your family, your loved ones, your friends. So this was the natural stage after we set the groundwork for prevention, which was social distancing. And again, you could say that about any date that you wanted. But my answer to that is now was the time. We saw the issue as necessary. And if not now, when?
Thank you. Jacques, do you have a quick follow-up?
Yeah, in the ice storm review, there was some discussion about public health and EMO needing to communicate better on carbon monoxide to the public. Is any of this a result of any concern about everyone working together, or and does EMO come under this task force?
So I wouldn't necessarily say that this has come out of that task force, but certainly we do try very hard to stay connected with EMO. So we have the emergency operations group within health, and they are directly connected every day in our briefing cycles with emergency management and operations. And so EMO is really a wraparound support for everything health is doing right now. And they are front and center in terms of everything that we need to be supported in the health emergency operations side.
Merci, Jacques. Silas Brown, Global.
Hi there. This is for whoever feels that they can answer this. But I'm curious how many healthcare workers we have in the province, that's both health authorities and nursing home, people in nursing homes and long-term care homes. How many employees have gotten ill at this point?
Well, that's readily available. I mean, the employees of Horizon is well known in their annual report, I think. The employees of Vitality are there. We have our 22 hospitals. We have, I think, the best part of 22,000 healthcare workers in New Brunswick spread across our system. And we do have a number of people. We have the locations. We have the resources, and we have the human attitude. So I don't believe that HR, in terms of numbers, is going to be a factor here. As I said before, this is going to be defeated outside of hospitals, not inside. There'll be more to that in due course about our state of readiness in our hospitals and things of that nature. But as far as the numbers of people, I think with respect to this virus alone and our projections, I think that the HR issue, I think, is well in hand. I do not believe we're understaffed.
Yeah, so I'm not particularly talking about this from an HR standpoint, but we saw that Shannon had said that an employee in a long-term care home in Quispam-Sith has caught COVID-19. So I'm curious if that can be released. How many healthcare workers in the province are dealing with this virus right now?
I don't have the exact numbers in front of me, so I think we are keeping track of how many healthcare workers have tested positive for COVID-19. I just don't have that number in front of me. And with respect to the case in Shanix, my understanding is I can't really speak directly to individual cases, so that's all I can say right now about that.
Matthew Wacomo, L'Acadie Nouvelle.
Bonjour, je pense que c'est une question pour Mme Russell. Dr. Russell, on avait, vendredi, on a appris que le Nouveau-Brunswick attendait une livraison de tests en province du fédéral. Je pense que le date, c'était lundi. Je me demandais si la livraison, la commande était arrivée et puis si ça incluait aussi de l'équipement de protection individuelle ou si on avait une commande de PPI là, qui s'en venait. Merci.
C'est la question sur l'équipement de PPE?
La livraison de test kits qu'on attendait pour aujourd'hui. Et je me demandais si dans cette livraison, si on avait reçu la livraison et si dans cette livraison-là, il y avait aussi du PPE ou si ça allait venir plus tard.
Moi, je suis seulement au courant sur pour les échantillons, pour les tests de dépistage. Et selon moi, c'est tout arrivé.
Suivi. Mathieu, as-tu un suivi?
Oui, on continue à avoir des informations contradictoires des représentants du gouvernement concernant la façon dont les tests et les cas sont compilés et transmis. Est-ce que c'est par l'endroit où le test a été effectué ou est-ce que c'est par l'adresse personnelle de la personne qui a été détectée positive? Je sais, Mme Russell, que vous avez déjà parlé de ça, mais pouvez-vous nous le répéter encore une fois?
Oui, alors, il y avait un changement à un point parce que c'était supposé d'être le code postal qui était la manière qu'on rapportait, mais il nous manquait des codes postales, alors on a changé au endroit où le test a été pris. Mais maintenant, on va recommencer à rapporter sur les tests et les cas sur la résidence parce que maintenant, alors le code postal, parce que maintenant, on est assuré qu'on a reçu 96,4% de l'information sur les codes postales à ce moment-ci.
Merci, Mathieu. Elizabeth Fraser, CBC.
Hello. My question is for Dr. Russell. We interviewed a woman who identified herself as the first community transmission case. She wants to be retested to ensure she's COVID-free before she ends her self-isolation, but says she was told by a public health nurse, you're not offering retesting anymore. Why is that? Is that because of a shortage of supplies, or can you explain any further?
So I can't speak to individual cases, but I can speak in a general sense about the testing procedures and when somebody is cleared of COVID-19. And the advice from Public Health Agency of Canada and our advice from the Office of the Chief Medical Officer of Health is that when somebody has mild symptoms, who has recovered at home and did not require hospitalization, those people are considered cleared of COVID-19 14 days after the onset of symptoms. And so that is the recommendation right now. I can't speak to individual cases, though.
Elizabeth, a follow-up, please.
I have another question for Dr. Dow. What are the top concerns of New Brunswick medical experts in terms of the equipment that hospitals around the province will need? And how will these concerns be addressed?
The top concerns by medical staff regarding PPE are, will we have enough PPE, and what is the best PPE? So and that is one of the roles of this task force, to make sure that we can message regarding supplies, we can message regarding what is the best PPE to be used in various circumstances. And as this is a dynamic, fluid situation, talk about upgrades as upgrades and changes will come as we have more information about this virus.
Thank you, Elizabeth. Megan Yamoa, Global. Megan?
We know there is a confirmed case at a daycare in Fredericton. Can you tell me what, if any, changes will be made to the cleaning or safety protocols for daycares in light of this?
Hi, Megan. So I don't really speak to individual cases in terms of regional teams working on the contact tracing and public health advice. And so I will just walk you through the process again. With every single case that's diagnosed of COVID-19, our public health regional teams will do the contact tracing. So the close contacts of the individual will be contacted. If there is an institution or a business or something like that, they will give advice to that institution or business around what other people in that population need to do, whether it's self-monitoring. And they also would give very specific instructions around cleaning. And then if there had been a public exposure, then I would be announcing that and it would be on our website. So that is the procedure for each and every case as it unfolds, and my regional teams look after those processes very, very, very well.
Megan, do you have a follow-up?
That's everything, thank you.
Thank you, Megan. Michel Corriveau, Radio-Canada.
Bonjour, merci. C'est une question pour Dr. Nicole Leblanc. Alors, Dr. Leblanc, j'aimerais savoir, il y a le PDG de Vitalité, M. Lantaigne, qui a dit qu'une centaine de membres du personnel ont été testés. Alors, combien de ces gens ont reçu un test positif?
J'aimerais pouvoir répondre à votre question, mais je n'ai pas tous les détails du nombre qui ont testé positif. Je peux certainement m'en informer puis vous revenir avec la réponse.
As-tu un suivi, M. Corriveau?
Oui, j'ai une autre question, cette fois-ci plus pour Dr. Russell. En suivi à la question de Mathieu Roy-Como sur les tests, j'aimerais savoir, vous avez reçu des tests aujourd'hui, combien vous en avez reçus?
Depuis hier, on a fait 250 tests. Vous voulez savoir combien qu'on a reçus qui sont positifs? C'était 3 que j'ai annoncé, je crois, ou 2 aujourd'hui?
Non, ce que je veux dire, les tests, l'équipement pour faire des tests, vous en avez reçu aujourd'hui?
Je sais seulement le total qu'on a. En total, on a 8 000.
OK, donc 3 700 la semaine passée, donc vous avez reçu autour de 5 000, j'imagine. C'est ça?
OK, merci.
Bruce, can I ask a follow-up question?
Hold on. Laura Brown, CTV.
Hi there. I'm hoping to ask Dr. Dow just to, I guess, reiterate your recommendation for people wearing masks. So should people begin wearing masks, say, if they are going to work, if they work in a grocery store, or if they're going to get groceries? Should people start wearing, homemade masks?
So we're talking about this today because this was the topic of discussion for the Special Advisory Committee. So all the Chief Medical Officers of Health for the country had met yesterday on this topic. And again, it was after reviewing the latest evidence-based information around masks. And we don't even really want to call them masks because technically speaking, we would like to reserve surgical masks for healthcare providers, period. So what we're talking about for the general public are face coverings, whether they be homemade, et cetera, and what the purpose of that is. So the purpose of wearing a homemade face covering or a fabric face covering is because of what we know now about asymptomatic transmission and pre-symptomatic transmission. And so the purpose of wearing such a face covering is not to protect you from getting infected with COVID from somebody else, but if you happen to be the asymptomatic person or the pre-symptomatic person, the face covering prevents you from infecting somebody else. And so that is the entire purpose of this. We do still recommend social distancing. We do still recommend hand washing. And yes, this would be for when you're out doing your groceries or running your errands when you're out in public. And again, Dr. Theresa Tam was speaking about this publicly today. So we have all of that information that we've consolidated again with the best evidence, and that is our recommendation.
Laura Brown, do you have a follow-up?
Yeah, just a quick one. Dr. Russell, on the website, the coronavirus website, earlier today, you talked about certain criteria, new criteria, it appeared to me, about if you could get tested, essentially. So if you have symptoms that are severe, if you're over the age of 60, if you have a history of hypertension, but that now has been taken down from the website. Is that the new criteria that you're working on heading into this week, now that you have more testing kits?
So it was always our intention to shift our priorities around testing based on two things. One, the national strategy through Public Health Agency of Canada around prioritization, and some provinces who are further ahead, further along in their pandemic in terms of case numbers, they have actually gone in the direction of that prioritization. For us, again, we're still early in our pandemic in terms of the epidemiological curve and number of cases and the type of transmission. So we haven't quite shifted from exclusively travel-related cases to exclusively or the majority of cases being community transmission. So we have been doing what's called sentinel testing in hospitals and emergency departments to look for community transmission there. And as we expand our testing criteria, we expanded it to healthcare workers who had symptoms but had not traveled. And then eventually, again, including essential workers, critical infrastructure workers would be contained in that group. And anybody who works in an institution setting, so closed institutions, for instance, prisons, in correctional facilities, nursing homes, and hospitals. So those are the vulnerable groups in terms of populations that we're really concerned about. Also, obviously, people who live in vulnerable situations, low-income housing, homeless shelters, things like that. So we really, really want to be protecting those vulnerable populations. And then removing the travel requirement for the public is one of the next phases in our testing capacity and protocols. So more information on that will be provided later in the week.
Thank you, Laura. Andrew Waugh.
Hello. My first question is to the Premier. Premier, so we've got this task force going now. We're obviously 3 to 4 weeks into the pandemic response. You dropped some fairly strong hints that there has not been information sharing and unity and cooperation. Who dropped the ball here, and where do the heads of the regional health authorities stand?
So, Andrew, this process is not about, looking for heads or dropping the ball, or it's about a continuous improvement program, as you've heard me talk about for many, many times. The idea here is to build a structure that takes out some of the, the bureaucracy in the middle. We've been operating government like that for some time, with all the four of us, the 3 other party leaders coming together as a group, our cabinet coming together as a group in terms of quick decision making. The idea that we can streamline the bureaucracy, that's already happening, because government is certainly not functioning like it normally would. It's functioning to deal with a crisis. And this is just one more element. And we will continue to involve, and we'll continue to engage people as needed as this pandemic evolves. To do otherwise would be folly and would not be in the best interests of our citizens.
Andrew Waugh, do you have a follow-up?
I do. There was also references to healthcare workers kind of speaking out as if it made it sound like you've heard a bunch from them and that perhaps they were very unhappy with how things were going. And I'd also like to get an update on the mask shipment that was due today and the N95 stuff that was coming from 3M, please.
Well, certainly, I'll engage the health minister here to talk about some of the details in that regard. But I think, we have a very strong communication network set up throughout the social media side, and numbers to call in, and comments and thoughts. And so the idea here is to build an organization that we can have not a whole multitude of ideas and opinions, but have them consolidated in one point, have a decision made, and then roll that out across the network, so we can avoid kind of the well, what did they say next? This is going to be a single source of information and decisions. Minister Fleming, do you want to add to that?
Yeah, Andrew, to your first question, I want to make it abundantly clear. This is no criticism of anyone. The health authorities are functioning as they normally do. They're seeing patients. They're treating people for cancer. They're doing emergency surgery. They're doing all the things that health authorities do. This is an additional crisis, and this task force is empowered uniquely to deal with COVID, and uniquely to deal with it very, very quickly and very, very fast. In the normal course of events, Horizon has a board of directors. It has a medical advisory committee. it has an operations, it has different types of this, and everybody has a particular role to play in normal times. But these are not normal times, and it's not about not having faith in any one particular committee or level of bureaucracy. It's that we don't have time. It's not possible to do this. The key here is to act quickly. COVID, without intervention and without mitigation, exponentially multiplies. And that's 2, 4, 8, 16, 32, 64, 128. And it does that about every 4 days. The system in its present form can't keep up with it. In the normal course of events, banks don't give loans the day you apply. There's a process. There's a loans committee. They look at this and they check a number of information. They want a plan and things like that. So it takes a couple of, maybe 3 weeks before you get your loan approved. Whether you're a bank or whether you're government, we don't have time to function in a manner that one would normally function when you're outside of a crisis. So the situation, whether it's the government, whether it's a bank, whether it's any kind of large organization which by their nature don't move quickly and have checks and balances and time constraints built into them. These are exceptional times. We don't have time to do this, and we need to stay ahead of this virus. We need to act fast, and the reason we're doing this is of no criticism of anyone. It is about this virus is no respecter of persons. This virus does not respect the organizational charts of any organization. It's exponentially multiplying, and this is an act of necessity. It is good planning. It is the right thing to do, and it is of no disrespect or criticism of anyone along the way. With respect to the test kits, we did get 5,000 in today, which greatly relieves the pressure on testing. And so that's good to know, and that's comforting. As far as the personal protective equipment, it is starting to flow through the federal government. Shipments are on the way. We have enough in normal times to last us out in excess of probably 12 to 14 weeks. So in situations like this, you go through them a little quicker, what is called the burn rate, and we need to balance that so that we don't use them up. I mean, if you've got a journey across the desert, you don't drink all your water on day one. And that's what we're doing here. Sensible, reasonable, balanced, putting patient and employees and healthcare workers first.
Thank you. Megan, you had a follow-up. Can you do it quickly?
Yes, thank you. Are we concerned about daycares spreading COVID-19?
I think we're concerned about all citizens in the province contracting COVID-19. Obviously, any institutions that are closed institutions, we have screening processes in place for hospitals now and government buildings and as well as nursing homes. So obviously, we're concerned about all settings in all areas of the province.
Voilà la fin de notre mise à jour. Merci, Docteur, Monsieur Premier Ministre, Monsieur Ministre. That concludes today's update. Thank you, Doctor, Premier, and Minister. Thank you.
Length of the preceding program, we now join the regularly scheduled program already in progress.
Huge. getting RTV to be known as the gold standard, getting 3 successive CRTC chairs to say, this is the best community channel system in Canada. I sometimes exaggerate and say in the world, but in Canada. And so getting 3 successive CRTC chairs to acknowledge that we were the gold standard, so proud of that. Winning the Omni license, not once, not twice, but 3 times after a bunch of appeals